All right, so I think we're live. Okay, so hey guys, this is Gavin here from Starfresh Personal Training, and I've got Dina on an interview with me today, and she's a bit of an expert around sleep and breathing. So I'll just quickly introduce her what she's got here. Okay, so she's a founder of a breath clinic in New Windsor. She helps people with asthma, hay fever, insomnia, snoring, sleep apnea, chronic fatigue and stress, and anxiety, and she helps them breathe easier, essentially. Just sleep deeper and just be calmer in everyday life, which is obviously very important in this day and age. And she does this by taking her clients through the Buteyko method of breathing and retraining, which allows them to feel a bit more refreshed, have more energy, and manage their stress a little bit better. And basically, her mission and passion is to help people breathe better to better health. And obviously, that's why I've asked her to jump on a call today. So we've got about 6 questions we're going to cover today, and she's going to answer them for us, and we'll go through it step by step. But thanks, Dina, for being with us. It's really cool to have a chat to you finally.
No worries, it's my pleasure.
Do you just want to introduce yourself? I know I've an introduction for you, but anything else you want to say now?
That about covers it, but yes, I stumbled across Buteyko for my own health, and because it worked so well for me and my family, I thought, you know, more people need to know about this. So I decided to train, and that's what I do now.
Wow, that's good. How long did you train to do it?
A little over a year. I could have done it in a year, but then, you know, family and study, so I chose not to stress about it, and did more than 2 years, or more than a year.
That's good. That's good. So, so would you be happy sharing a little bit about your background and how it's kind of helped you?
Yes. Well, in 2012, my asthma, I have mild asthma, never caused me any problems before. And so in 2012, after exposure to chemicals from the carpet change, and, you know, the usual chemicals at home of cleaning chemicals and all that, my asthma turned for the worse, and I couldn't even walk without getting short of breath.
Wow.
And so hunched over and difficulty in breathing. And my GP then couldn't, you know, gave me all the medications and everything that she knew what to do, but it wasn't helping. So I looked for, you know, I looked for a second opinion, and this GP picked up that I had hyperventilation, and he said, you need to address your breathing, the way you breathe. And so he recommended a Buteyko course, and it helped me from the very first week. I saw changes, and with this new doctor's help, over 9 months, he was able to taper off all my medication. And so for 4 years now, I haven't needed any of my medication. I had 4 then, 2 sprays, 1 nasal spray, 2 inhalers, 1 nasal spray, and 1 tablet. And yeah, so I haven't needed it in 4 years.
Wow, that's actually really good. It's really impressive. Yeah. A lot of my clients, I deal with lots of people over the age of about 40 years old. So as you can imagine, a lot of them are quite out of shape, and they've maybe overweight. They have trouble sleeping with like the sleep apnea type stuff. Certainly with people that are overweight. And you know, what we found is that sometimes because they're not getting good sleep, they haven't got the energy then to exercise, and they haven't got the energy to concentrate on their nutrition and all those sorts of things. And like I kind of harp on about good sleep all the time, but it's very difficult to do, and people don't really understand the benefits of it. So the first question I got for you really is, you know, what's the main different kinds of sleep that we sort of have? I know we sort of cycle in and out every 45 minutes or so, don't we? Is that correct?
Yes. So there's the non-REM, non-REM. REM stands for rapid eye movement, and there's the REM. So the REM is a deeper kind of sleep. Now, for me, it's not really much of the REM and the non-REM. It's more because that's a technical term. So for us, you know, lay people, we go for more for just how we feel and the symptoms after our sleep. So there's so many gadgets out there now to track your sleep. You know, the Fitbit, that one, and then you'll see all the graphs, and you look at it and you think, okay, so how does this help me? What will I do with this information? So sometimes you don't even need any gadget. It's just how you feel, and then addressing that particular problem, finding the person to help you. And that's what I do with my clients. So those two, because we really go in and out of the REM and non-REM sleeps. Sometimes you think, oh, am I waking up too many times in the night? Yeah. As long as you're not waking up, meaning opening your eyes, and you're not aware of any wakings, that's fine. But then you could be asleep the whole night, and then when you wake up, you're tired. So that's not fine. So those are the things we try to look for. I
must admit, I do some shift work as well.
Yes.
And I've just come off night shift yesterday. And what I found is last night in particular, I had about 9-10 hours sleep, but I felt exhausted this morning. Obviously that's a night shift, isn't it, I guess?
Yeah, it throws off your circadian rhythm, because of the cycles, your sleep cycles.
So with regards to that, the way sleep affects us, can you just quickly explain how it kind of affects us, like both physically and mentally as well? Because I know it's quite different things, aren't they?
Okay, so sleep really has 3 major benefits to us: rest, regeneration, and repair. So that's for our body. So that's when the body takes care of the housekeeping, repair, and all those things. So if we don't get enough rest, we don't get to do that. Now, particularly, say, for brain function. So sleep is when we, good sleep helps us with memory, sharpens our attention span, and consolidates learning. They've had studies with this, that is when you're asleep, things that you've learned during the day gets consolidated in your brain. And your creativity is heightened when you get enough sleep. And then also the lymphatic system in your brain, is what cleans the brain of all its metabolic, the toxins of the metabolism. It works at night. Right. So if we don't get enough sleep, so you can imagine you've got your dirty brain. So you've got a lot of toxins just there, and that contributes to your brain not functioning as well as it could.
Right. Oh, that's interesting to know, actually.
So that's the brain, and the rest of your body. Lack of sleep causes inflammation, and we know that inflammation is the cause now of illness, and of chronic illness especially. So that's something we need to consider.
That's really interesting. So with regards to weight loss and stuff like that, I mean, obviously a lot of people are overweight, and people can be attributed. I mean, obviously diet and exercise is part of that, but how important is sleep to the sort of weight loss?
Yes, so that's the other benefit. So aside from those ones that I've mentioned, it helps in your metabolism. See, the sleep and metabolism is controlled in the same area of the brain.
Right.
Yeah? Okay. So when you're sleepy, certain hormones are released, and these hormones also cause us to be hungry. It drives our appetite.
Yeah.
And then the other thing is also that lack of sleep, either way, it's a vicious cycle. Lack of sleep causes stress. Stress causes lack of sleep. And we know too that stress, when the body is in a stress mode because you're not sleeping well, then your body shifts from burning fat to fat storage.
Wow.
So when your body is in stress mode, it goes into fat storage. It's like the caveman brain, I guess. It's just saying, danger, danger. So we're in danger. We need to set aside some, some of this for the future. So it's going into that mode.
That's a really good way to look at it, to be honest, because I don't think I'd even thought about it as regarding the stress factor. People highly stressed do tend to carry lots of weight as well, and it's probably all those reasons, your body trying to preserve itself for times of hardship, I guess, isn't it?
Yeah.
That's really cool. So that's actually really interesting, to be honest. I didn't even think of that. So, sleep has lots of other benefits as well. What other type of benefits do we have apart from those ones you just mentioned?
Well, on the positive note, it helps because sleep will help your body function better. So sport performance and in your exercise, for physical peak performance in the physical sense, it improves that as well. Now, Well, I was going to say, sorry, can I just go back to the other question that
Absolutely, yeah.
when you're sleep deprived and you've got breathing problems in your sleep disordered breathing, and then your circadian cycles are off, then it causes the dysregulation of your hormones. That's what we were saying. And then that is what will affect your metabolism, your glucose metabolism.
Right. Okay. Yeah. Yeah.
Okay.
Because I know with I personally, for me, if I'm up late at night and I've had long days, I tend to feel really hungry. I feel like I want to eat lots of sweet stuff. And I know that's like an imbalance of leptin and ghrelin, those sorts of hormones. Do you know much about that? You ever talk about that? Or
that's it, because then your body's craving for that sugary stuff because of the hormones being released in your body. So that's the one that's driving your appetite, you know, because of, and then therefore you're looking for sugar. And why sugar? Again, looking at it in I really like putting it in a very simple and something that we can imagine. If you're under stress and your body, so you're in danger, your brain sees that you're in danger.
Yeah.
Fight or flight means either you fight back or you run away. Now, what kind of fuel do you need? Will you use fat that's slow burning, and you know, it takes a bit of a process to get it into the form that you can use as fuel?
Yeah.
Or would you get something that's easily used as fuel, such as sugar?
Yeah.
So the brain is now thinking that I need sugar, because now we're in sympathetic mode, we're in stress mode, emergency, and we want to get fuel as fast as possible. And that's why the message that the brain is telling you is eat more sugar, eat more sugar.
Yeah.
So that's how it's going.
Yeah, that's really interesting. And like I personally find it as well. And I've trained I've trained a few nurses and a few shift workers as well, and they always say that they just really struggle to come away from the sweet stuff. And what tends to happen is people bring in sweets and cakes, as you know, because people do that sort of thing anyway. And when they're there ready for you at that time of night, when you're stressed and tired, then you go straight for it.
Yes.
People struggle with that. Yeah.
And the underlying thing on all that is stress, because again, your body's under stress. It needs to sleep. It's not getting the sleep. And so you're under stress. Yeah,
very interesting. So what, I know when I did my personal training course quite a few years ago, one of the instructors there used to train lots of high level athletes. And he always used to band around the sort of 10-hour mark for resting. Now, you read everywhere 7 to 10 hours. 3 hours is quite a big sort of gap, isn't it?
Yes.
And what he used to say was that if his athletes didn't get like 6 or 7 hours, he would then prescribe them to sleep 2 hours in the daytime as a nap.
Well,
what are your thoughts on that?
Sleep requirement depends on a lot of things. One is age, and the other thing is if it's, say, mild to moderate exercise, as long as you're not pushing too much, like what would be pushing? Pushing too much would be, say, marathon or a triathlon, or training for one, because you know how you really push yourself through training for one. So that's pushing it hard. Then maybe because you're pushing the boundaries, you're pushing your body's limits, you might need more sleep then. But other than that, even if you train in the gym, even if you have your own sport, the regular, say, footy and the field, that would still be 7 to 8 hours of sleep. If you're feeling like you need more than 7 to 8 with just the regular, games and all that, then you have to look at the quality of your sleep. Am I not getting the good quality of sleep during those 7 to 8 hours? Why is it that I feel like I need more time? So then you look at the quality, because if you're not breathing right during your sport, and then you won't be breathing right during your sleep, then the quality of your sleep will suffer. And that's why when you wake up, you will not be feeling well. So rather than looking at the time, how much time you sleep, I'd rather go at the quality of sleep. So how do they know if they're getting quality sleep? You're not getting quality sleep if it takes you a long time to fall asleep, say more than 15 minutes to fall asleep. If you wake up more than once a night, so 0 to 1 is fine. if you say wake up earlier than your alarm and to say just after 5 hours of sleep, and you feel tired, or maybe you sleep 8 hours, but then you wake up feeling tired. So that means you're not getting good sleep.
Yeah.
Or when you're breathing heavily at night or snoring, or if you have sleep apnea. So those conditions, definitely you're not getting good quality sleep. And more likely you will be wanting more sleep. Your body will be craving more sleep just because you're not getting the rest that you need, not getting the deep sleep that you need.
Yeah.
Now, if you're breathing right, some people can even last with 6 hours. Healthy breathers can last on, if they're doing mild to moderate activity, exercise and games and sport, 6 hours would be enough for them if they're breathing really, really well.
Wow, that's really good.
Yeah.
It's all about quantity as opposed to, it's all about quality as opposed to quantity then.
Yes.
Yeah.
Yes.
So I was going to ask you a quick question actually. When which wasn't what we sort of prepared for, but when I used to do martial arts, I used to talk about breathing from your diaphragm as opposed to your chest. So you got chest breathers and you got stomach breathers. Can you explain that? I'm more interested myself, to be honest, because people quality of breathing. If you breathe from your diaphragm, isn't it, as opposed to breathe from your chest?
Yes.
Is that what we're talking about?
Yes, it's just that, but we all know that. At least I knew that as a kid.
Yeah.
But I didn't know if I was breathing through my diaphragm or not, or how to do it.
Yeah, that's how to do it is the thing, isn't it?
So you think I guess I'm breathing through my diaphragm, and sometimes I have people in front of me, my clients, and they say, no, I breathe through my diaphragm, and I'm watching them, and I see the chest going up and down. So they're not aware. We're not aware. Neither was I. I was a chest breather before doing Buteyko. And so yes, diaphragmatic breathing, but that is difficult to tell someone when they don't know how. Yeah. And that's how I help my clients. But the easier thing to do initially is this. One is to breathe. So some tips to fix your breathing so that you get better sleep is to make sure that you're breathing through your nose, in and out through your nose, through mild and moderate activity. So being in the gym is moderate activity, according, so even in the gym. And what's happening, this is quite interesting. I think you might see this. A lot of people are physically fit, but so this is their physical fitness, but their breathing fitness is way down here. And that's where their mouths are hanging open in the gym, mouths hanging open, because yes, physically they can do whatever it is they're doing, say on the treadmill and going very fast, but their breathing is lagging behind. So what they need to do is fix their breathing so their breathing supports their physical fitness, and they will even surpass what they're already able to do now, because then their breathing fitness and their physical fitness are going together. So that's one, the breathing through your nose, in and out through your nose the whole day through mild and moderate activity. And then posture. So proper posture will release the diaphragm. I don't know if you can see, but just a slight slouch will already lock your diaphragm. Right. So the diaphragm is not free to move, and therefore your body will automatically shift to upper chest breathing. So having good posture is very important for good breathing. And the third, I could say, is relaxation. Because we're so just, gung-ho, go. We've forgotten how to relax. And relaxation just automatically, without us even thinking about it, automatically makes our breathing slow down, calm down, and shifts it to diaphragmatic breathing. Because relaxed breathing immediately is actually diaphragmatic breathing. So our bodies know that, but we just need to give it a chance to do it. And when we're always on the go and not relaxed, then it doesn't get the chance to shift to diaphragmatic breathing.
That's really good to know. Relax is the key, isn't it? So with I'm just going to pick up something you said regarding like sleep. So like I said, we're talking about when you start hitting over 40, a little bit overweight, all those sorts of things. Does the sleep kind of change as you get older? Or, I mean, people say you need less sleep as you get older. Is that true? Is that a myth? Or is it just down to the quality and how you feel?
Yeah, it depends on sleep, depends on a lot of things. So it depends on what illnesses they have. So some illnesses will make them, so autoimmune diseases will make them sleep longer and things like that. But if a person is well, they should be the same 7 to 8 hours on the average. Very good breathers, even if they're old, will just need 6 hours.
Yeah.
But the thing is, some people say, oh, I just need 6 hours.
Yeah.
But if you ask them, how are you after the 6 hours, then you'll see that they're tired. And so, you know, again, it's looking at the overall effect of the sleep to know if the sleep was good or not.
Yeah.
Yeah.
So I'm going to ask you, like, we're nearly done, to be honest. We covered that pretty quick, which is awesome. So I'm kind of about, when I do these interviews, I haven't done that many, but I want like, you know, a practical tip that you can do, like, now, like a master tip. So someone that's watching this video now, tonight, they can go, right, I need to sleep better tonight. From now, how can I do it?
All right. Well, one and the biggest tip really is the nose breathing. But what I can add to that you can do tonight is sleep on your left side.
Okay.
The worst sleeping position is on your back, because then everything, your airways sort of collapse, your mouth, especially if you have a tendency to open your mouth in your sleep, your tongue moves back, your palate, when your mouth is open, your palate sort of closes off the airway, and that's the cause for snoring and sleep apnea sometimes.
Yeah.
So sleeping on your left side immediately, just by the position, helps avoid that.
Okay.
So it's not a total, so if you've got snoring and sleep apnea, it's not going to be a total thing, but at least there's a small change, and it's a small improvement. But again, it's it's how you breathe. So, and maybe sorry.
Oh, go on, carry on.
Okay, so the other one is to have that, like we were mentioning earlier, relax, good breathing from sleep. So what you need to do is to have some sort of a routine before bed that helps you relax. Yeah. Because then, like I said, your breathing calms down, slows down, and becomes gentler when you're relaxed. So a good, maybe a bath or reading a nice book, meditating, praying, whatever works for you, as long as, just get yourself relaxed just before sleep. Will be very good.
Turn off your iPads.
No, that's not good. Especially, do you know that increases your breathing rate just by using technology? It increases your breathing rate and your pulse rate.
Is that right?
Yes.
But is that the same for TV? Does the iPad have the same effect as the TV, or is the iPad an iPhone?
Maybe because it's used nearer, and so there's the EMF, the electromagnetic field effect there as well, aside from the light, because the white light that disrupts your melatonin production. Is also the issue there. So with TVs, usually they're far away. I don't know now that we've got huge, gigantic TVs, right, so the light's also a lot. But even TVs.
Wow, that's really interesting. So I think we've covered everything, to be honest. What I was going to say was, why the left side? Why not the right side?
Oh, well, Dr. Buteyko, who's a Russian doctor, and he was the one who developed this Buteyko method in the 1950s. He observed thousands of patients in the hospital, and he saw that the breathing rate is slowest on your left side, and then the next best position is on the tummy, but I don't know about the head. That's going to be difficult with your head, right? But then because that restricts breathing, because you're sleeping on your tummy, it sort of restricts breathing, so it slows down the breathing. Then the next one would be the right side, and the worst would be on your back. Right. So but there's also lots of other good effects on that. The left side is better for your heart because of the pumping out with gravity, so your aorta goes to the left, and also your right lung is bigger. So if you're sleeping on your left, then the area for gas exchange is bigger, more efficient, because your right lung has 3 lobes. So many other health benefits of sleeping on the left side.
Wow, you might have to tie yourselves up with pillows and stuff just to keep you in position.
Put them on your back.
That's right. All right, well, that's really cool. Like, it's been really insightful, actually. It's been really interesting to me to listen to what you got to say. So before you go, whereabouts can we find you? Where are you? Have you got an email address or or a website or anything?
Yes. So our website is www.thebreatheclinic.com, and you can reach me at Buteyko@thebreatheclinic.com. I also have a Facebook page at The Breathe Clinic.
Yeah.
And yeah, so you can see me there. I have, and I've given Gavin a PDF on some more tips on sleep so that he can make that available to you later on.
That's so good. So yeah, I always appreciate that little free gift for everyone. That's gonna be perfect. So so anyway, I'll thank you again, and we'll just we'll sign off. And thanks, brilliant.
All right, thanks to Gavin. Pleasure. Bye.
If you have enjoyed watching this webinar, we offer you to come and have a free, no obligation Discover Your Inner Youth assessment to discover your biological or physical age, which can vary from your calendar age. This may give you an indication of the state of your health. The assessment is easy to do, and it involves 10 simple physical tests and questions about your lifestyle. It takes place in our Howick clinic in a convenient location with plenty of parking. Depending on the results of this assessment, we may offer you participation in our Growing Younger health program. You may have heard about this program from your friends or neighbors. It's totally up to you to decide whether you want to join the program or not. All you have to do now is express your interest, so you can go to this link below that you can see on the screen, or you can call our 24-hour message line and leave a message with your contact details. The number is 0800 11 0028. Okay, see you soon.